Good morning, good morning, good morning, everybody. Welcome to our Oak Hill Regional Community Development Corporation Get Covered Mississippi 2024, open enrollment kickoff telethon. Look, my name is Michael Miner. I'm the Executive Director of Oak Hill Regional CDC, and we're so happy today to get this open enrollment season started. This brings joy to me. Did this for the first time back on October of 2013. This is our 11th open enrollment session. Oh wow, we are excited about what we're going to do today and throughout this open enrollment season, which actually ends on January 16th because of the Martin Luther King Jr. birthday, federal holiday. Okay, look, what does it mean, open enrollment? Well, as we love to say in our faith-based community, it's great to have assurance, but we need some insurance. So this is the time that if you don't have health coverage through your job or through Medicare or pension, whatever the case may be, you can come to any one of our sites across the state of Mississippi. You can call us. We'll do some things virtually, and you can enroll through the healthcare.gov, the marketplace, so that you can get coverage for you and your family. And recently, with the new law changes, with the assistance that you can receive, the premiums are affordable. Or as I always say, look, what is it going to hurt you? It doesn't cost anything to work with one of our nearly 70 navigators all across the state of Mississippi. We'll walk you through the process. Look, you may have insurance on your job for you as an individual. When you try to get coverage for the rest of your family, wow, it shot sky high. So the only person in your home that's covered is you. Well, because of the change in the family glitch last year, you now can come through the marketplace. Yes, you can keep your coverage through your employer, but now you can look at the rest of your family and get them coverage through the marketplace. The Affordable Care Act, Obamacare. You know what? Maybe you're thinking about retirement. You know, you're up in that age, you're in that 60 plus something age bracket, and you're kind of counting up till you get on start drawing Social Security, get on Medicare. Well, that's a great opportunity for you to look at having the ACA coverage until that time that kicks in. Or maybe you've lost your job and you're on Cobra. You can, you got a choice. You know, we get Cobra or you can go to the Affordable Care Act. We can look at what those premiums are and make determination that it may be a better choice to go through ACA. But once you have to make that choice right away, because once you start on Cobra, then you can't come back and start on the Affordable Care Act. Yes, we know that even with the subsidies, the help that people get, that it still may be too expensive for some people. Okay, we understand that. So we can make a referral to one of the many federally qualified community health centers across the state of Mississippi. Yes, we can connect you there. And of course, it's not the same as health insurance, but you can make a connection and get a health home. They see patients on a sliding fee scale. Well, I would also encourage those that are not that have health insurance, that when your communities, that the community federally qualified community health centers have great health professionals. As a matter of fact, my mom used to go up to South Haven, which is about 35, 40 miles from my home to see for her checkups and things. Well, once the Aaron E. Henry MJ Edwards location opened up in Coldwater, she decided to start going there. And she has been very pleased. It's only about a 10, 15-minute drive. It's right there in her hometown. When she's done, she can go maybe get some shopping down there at the K's or the Walmart down there. She has nothing but kudos to say about the health professionals there at the MJ Edwards location of Aaron E. Henry. So we do encourage you to do that so we can help our federally qualified community health centers to have some patients that come through that do have coverage. That way it's a help for those who don't have it. Look, we know that you have people in your family. I talked with someone over the weekend that has a family member that has no coverage at all. So look, even in this time, this going into our 11th open enrollment season, where we make the assumption that everybody knows that you can get coverage through the ACA. Well, we'll find that's not true. So if you got families and family, friends, others, let them know that open enrollment has begun for the Affordable Care Act. Yes, and we are here and we're available. You can give us a call at 662 298 3584. That's 662 298 3584. And we have a statewide network. Don't fool yourself. We are all over the state of Mississippi. We are all over the state of Mississippi. Can I say it again? We're all over the state of Mississippi. And just to show you here where we are, we have 10 regions. As you can see by our coverage map. 10 regions. We have 10 regions. Right now, I'm speaking from Region 5 at our headquarters location in Hernando, Mississippi. But we have coverage all over in North Mississippi. We have connections with ICS Head Start centers. We have navigators that also work in these centers, and they can reach out to you, or you give them a contact. We contact us. We'll get you in contact with them. In the northeastern part of the state, we have Catch Kids, who's been great for us both in our Get Covered efforts and our Healthy Kids Mississippi. Down in Region 8, which includes the Golden Triangle, we have a number of assistants there that can assist you and make things happen through our Get Covered Mississippi Golden Triangle team. When you go down to East Central Mississippi, around Meridian, we have a great relationship with the East Central Mississippi Regional Community Development Corporation, in collaboration with the East Mississippi Baptist State Convention. And then you come back up and go into Region 4. We work with Aaron E. Henry, Federally Qualified Community Health Center. And in Region 6, we have both Aaron E. Henry and we have ICS Head Start. In Region 3, we have our Get Covered team that works in the greater Cleveland area and work in outreach. And also we have another relationship with Head Start centers, the Washington County Opportunities out of Greenville. And of course, in Region 2, around our state capital, we have our Get Covered team that's there at Fair Street Baptist Church. And we also have an overlap there with Scott County that's in Region 9, but it's in Metro Jackson, that we can work with you to get things done there. Of course, in Region 1, we have our team around Macomb, and we'll branch out those other areas that can assist you. And finally, in Region 10, excuse me, we have Boat People, SOS, and Mercy Housing and Human Development that they're there to assist you. So wherever you are in the state of Mississippi, you're not more than 30 miles from face-to-face assistance. If you prefer, you can give us a call again at 662-298-3584, and we'd be more than happy to work with you to get coverage. We want to ensure that, and across the state of Mississippi, we have people that can make a connection and they can get covered. Get Covered Mississippi. That's our goal. So again, let's go back through this again. If you don't have health coverage, you don't have it, look, give us a call, 662-298-3584. If somebody in your family doesn't have health coverage, give us a call, 662-298-3584. If you're thinking about retirement and you're not quite there on age-wise to get on Medicare, give us a call at 662-298-3584. If you're a grandparent, great-grandparent, and your grandchildren, your great-grandchildren don't have any health coverage, give us a call at 662-298-3584. If you have lost coverage through Medicaid, through the Children's Health Insurance Program because of the end of the public health emergency, give us a call at 662-298-3584. Maybe you've gone through and you tried to work through that application for coverage through the Mississippi Medicaid or Mississippi, the Children's Health Insurance Program, and it's just so difficult. You just threw your hands up in there. Well, give us a call, 662-298-3584. If you're working on a job, you got good coverage, but you can't afford to bring the rest of your family on, give us a call at 662-298-3584. If you, before open enrollment, you were got into a temporary health plan and you found it didn't really cover that much. Yes, it was a very inexpensive premium, but when you went to the doctor and stuff, this wasn't covered, that wasn't covered. Well, give us a call at 662-298-3584. Well, if you know you just confused about the coverage that you already have, and you wanted to walk through uh, what's covered, what's not covered, give us a call at 662-298-3584. Well, if you're hearing this and your church or community group and you're saying, wow, I would love for us to have a workshop or a conference to talk about open enrollment before it ends on January 16th. Well, give us a call at 662-298-3584, and we'll come and work with you on that day. If it's an employer and you know you're small and you're not able to provide health coverage for your employees, well, we can come and set something up. We go to your company and see how we can get your employees enrolled in coverage through the Affordable Care Act. So give us a call at 662-298-3584. Maybe you're thinking it's like it was years ago, where if you had a pre-existing condition, you weren't able to get coverage. That's not true under the Affordable Care Act. You can still be covered. So give us a call at 662-298-3584. Or maybe you have a person in your family that you know they were a veteran and they don't think that they can get coverage. They only serve one day, but one day active duty makes them a veteran. Well, give us a call at 662-298-3584. Look, if you're just seeing this and you just don't know where you fit and all this, but you have some questions and concerns about your healthcare coverage, and maybe making a connection there, give us a call at 662-298-3584. Maybe you've already started. You woke up early this morning and you started work on your application, and wow, you got to a point where you just don't understand something. You just need a little bit of help to finish the application. Give us a call at 662-298-3584. See, you should know our number by now, 662-298-3584. We're going to be here. We're going to have a lot of great activities. We'll be having updates throughout the day with our telethon. We thank y'all for sharing. Share this on your Facebook pages. Put your comments there. Our navigators are going to share it and put their contact information all across the state of Mississippi. Yes, get covered, Mississippi. Oak Hill Regional Community Development Corporation. We are excited about the 2024 open enrollment kickoff, the first day, November 1st. It may be cold outside, but it's hot here at our headquarters because we're fired up and ready to assist our fellow Mississippians in getting health coverage. So give us a call, 662-298-3584. Now, I know Duke is probably reminding me, our metrics and tech person, that look, you can also go to our website, getcoveredms.org. Getcoveredms.org. A lot of great resources there that we can assist you. And again, if you've done this before and gone through it, there are some new changes that have come about. For the many folks for years got the bronze plan because that was more affordable for them. But with the new law changes, you will find that with the help that you may qualify for, that a silver plan, yes, you may get a silver plan with more coverage, more benefits now than that is for the same cost as a bronze plan. Yes, your bronze plan payment last year could cover a silver plan this year. So you need to give us a call so we can walk you through this. If you already had coverage and you've enrolled yourself, let's talk about it. So give us a call at 662-298-3584. Look, we are federally funded. We are not brokers. We're not insurance agents. We don't charge you anything. We don't work on commission. We just do this as really it's ministry for us because we're a faith-based organization. We're just excited to do some things to help our fellow Mississippians so that they can get the health coverage, amen, that they need. And so we want to work with you to get this done. So today, give us a call, 662-298-3584. Look, if you're tired up and thinking, wow, this is a telethon today, and if I don't call them today, it's too late. No, if you don't get us today, We're going to be here throughout the entirety of open enrollment that ends January 16th, 2024. But guess what? We are here. We are here. Even once open enrollment is over, we're here to assist you. There may have something for a special enrollment period, other things that may come up, but we're here a year-round operation. Yes, across the state of Mississippi. But again, give us a call at 662-298-3584 so that we can assist you. We can answer your questions. We can walk you through the application. And again, not only get Covered Mississippi with our emphasis on the healthcare.gov, the marketplace, the Affordable Care Act, we are here again. We know that the federal health emergency is over, and that a lot of people had coverage through Medicaid and the Children's Health Insurance Program, and they've been rolling off. Some people didn't even know they didn't have coverage. Well, doing this open enrollment for the ACA is another opportunity for us to tell you, we can help you. If you lost coverage for Medicaid or the Children's Health Insurance Program, CHIP, with your children, give us a call. Look, I think the last count, we have assisted over 200 people that was fairly easy to get done in the last couple of months to get them back on, get them back for coverage. We have some people, you know how it is when you get a phone call, and it's not somebody, a family or friend, you don't answer. So we keep on working that. We're sending postcards out. But slowly but surely, we are working with thousands of Mississippians across the state so that they can continue in their coverage with Medicaid and the Children's Health Insurance Program. So if you know somebody that has been on it and they haven't checked on anything, they said they haven't received a notice, give us a call at 662-298-3584, 662-298-3584, and we can assist them. Just a couple of instances. We had a family that we just thought all hope was lost, that they went to the doctor and they checked it and they were not covered by Medicaid or CHIP. But one of our navigators made a call, and the family was just ecstatic. Didn't realize they could continue in coverage. Work with them, the coverage, they received their coverage, and they're all excited. Well, look, not all the time can we get people reinstated. You know, changing income, whatever the case may be. Another family we work with, but guess what we were able to do? We weren't able to get them to the Medicaid or CHIP, but we're able to connect them with a federally qualified community health center, so that the family could have their children to have their checkups and everything else as they were getting ready for school. We were excited about that, and we asked them, could we keep their contact information so we could follow back up with them? And so if their circumstances change, maybe they too can qualify for the ACA. But look, at Oak Hill Regional CDC, we Get Covered Mississippi, our overall goal is simple. We just try to work with people to connect them with a health home, whether it's through the marketplace, which is we call Obamacare, the Affordable Care Act, and get you a plan. This is not the marketplace is not a federal health insurance plan. It is private insurance. We have several insurers, private insurers. All it does is the federal government is using this marketplace to connect our fellow Mississippians to one of these private insurance companies so you can get the coverage, quality coverage that has preventive services. It's the real deal for coverage. That's what we do. That's during this open enrollment season. All right. But also, you may qualify for Medicaid or the Children's Health Insurance Program. If you do that, we can help you with the application, even helping you get the application to one of the regional offices of the Division of Medicaid. We can do that and work with you. Again, we make referrals all the time to people to the VA. They don't realize if they serve one day active duty, there may be some benefits that they're available for. We make referrals down for those down in the other part, lower part of the state. We would make referrals so they can contact the VA hospital there in Jackson. Those up in North Mississippi to make contacts with the VA hospital here in Memphis. We're doing those things to let people know. All right, Medicare. We know this is Medicare open enrollment season as well, and we share some information with folks about that. We still have people that don't understand about how their qualification for Medicare. We can do that for you as well. People may have you have the coverage and you're having difficulty finding a specialist. We can work with you and looking at the coverage map and the doctors and the hospitals that are on this. Again, 662-298-3584, 662-298-3584. We can help you in all those instances. We have people calling us up that want to know, well, can I go and get my mammogram and it be covered and no deductible? No, yes, you can. Can I get my prostate checked out? Yes, no. It's one part of the preventive services. And look, through the Affordable Care Act, they also have coverage for mental health. We know through the pandemic, especially some of our children had some issues and stuff with that. So yes, you can get covered that from part of the preventive services. You can do those things and make some things happen. But again, we are excited. Look, I've run way beyond what I planned to do, but you can see the excitement. And look, I don't have a script in front of me. I'm just talking from my heart. Been doing this since 2013. We just celebrated 10 years of Get Covered Mississippi. Look, forget about everything else. If you don't have coverage, today you need to make a decision to get in contact with Oak Hill Regional CDC, Get Covered Mississippi. Call us 662-298-3584, 662-298-3584. Go to our website, getcoveredms.org, getcoveredms.org. But whatever you do, get covered, Mississippi. All right, God bless you, God keep you, and we'll be coming back again with the next part of our telethon. So stay tuned. It is the kickoff for the Affordable Care Act.